So here's the thing, just in terms of one, and that's why it's important to talk about decreasing some of the panic. For instance, our grocery stores are restocking every day. There is food available, and we're not urging people to go out and stock up and have supplies for months and months at a time. And if everybody goes to the grocery store and has food for weeks at a time, like typical, there will be enough food and enough supply in terms of regular grocery store shopping, typically. What we are doing, though, is preparing for possibilities of a major pandemic and things getting worse for us. So we have a hub right now at the Senior Center. We have Meals on Wheels who have set up in the Produce Mart. We are also talking to other bigger property areas in the district that will be able to set up emergency food centers, emergency distribution sites, and in some cases, pop-up sites to provide emergency services. We are not there yet, but we are in preparation to make sure that that happens. But if anyone who needs food right now, if you know someone who is isolated in the district, if you know seniors or young people who are not getting access and families who are not getting access, you can always email us at waltonstaff@sfgov.org, and also give us a call at 415-554-7670, and we will immediately jump on connecting you to resources available. And I'll get into a long list of resources that address food security, what we're doing to address homelessness, what we're doing for all of our populations. But those are one of the ways that we are making sure that we are able to address the needs of people who need us right away. Because as you know, some people need support and services on the dime, and we're available to provide those opportunities and connect folks to the support that they need in the meantime.
Love that. And I'm going to I stepped into the chat here, just taking a look, and there's some really great questions since we're sort of on this sort of part about food security. Are there grocery store hours for seniors?
So some of our stores have grocery store hours for seniors starting at 7 for 60 and up. Some of them have classified it as 65 and up. Your Whole Foods, your Safeways, all of our grocery stores are working together to make sure that those hours are provided on the early end of the day. Now, we also know that there are people who are not of those ages that are participating in those hours, but had a conversation with someone who is right now confined to the home, a senior with a disability, and they just also want to be mindful that they do have young people going to the store for them. They do have people that are trying to make sure that they receive goods and services in home. So just remember that we are working on an honor system to make sure that people are really adhering to the fact that we do have people with different needs, like our seniors, like our disability population, but they also have people that are supporting them, that are making sure that they get the goods and services that they need. But our grocery stores are opening early for that demographic and for that population. And specifically on Wednesday mornings across the grocery store network.
Oh, great. Another question. Will SFUSD open more lunch pickup sites in Viz Valley?
So I can't guarantee that. Obviously, we're pushing hard to make sure that happens. My team has been working with SFUSD, Board of Education, as well as school leadership as we speak to get a site open in Viz Valley. The original list that came out also didn't have a place in the Tenderloin. It didn't have a place in the Mission District. Our office immediately jumped on that, and we got more sites added. And so we're hopeful that we can do the same thing for Visitation Valley. In the meantime, while we work to get a site open in Visitation Valley, because we have so many young people in Visitation Valley, we do encourage people to use the June Jordan site or one of the Bayview sites as we work to get a site specific to the Viz Valley geographic.
Could you repeat the 4 sites again? I think they were Willie Brown
Middle School, which is on Silver. We also have International High School in Potrero Hill, George Washington Carver Elementary School, and Bret Hart Elementary School.
And what we will do is work with the supervisor's office to get those and be able to email them to the people who are on the line right now.
And we have a plethora of resources. Of course, we put on Facebook. We send out newsletter. We have a resource guide. I'll give you some of the links and updates of where to go to find that information. But if you go to dcyf.org, their site definitely lists all of them, as well as SFUSD. Their site lists all of the locations across San Francisco.
Great. And we will definitely get that and be able to send that out to people who are online sort of directly. Actually, Captain Dangerfield actually had a really great point to make, and I just wanted to sort of get to that too. His point was really that can you add that we know that kids are at home. We don't want the youth playing youth sports like basketball, et cetera, because social distancing. Really do appreciate that point, Captain Dangerfield, and wanted just to be able to communicate that sort of to everyone on board here.
Yeah, and we are in a predicament where, of course, we're encouraging exercise, activity that you can do by yourself, maybe one or two people, social distancing, whether it's going for a walk or being out in the park. But we do not want people exercising together. It's definitely personally hit me and affected my life. You asked the question earlier, have things changed? And they've changed for everybody. I typically play basketball on Monday, Wednesday, and Friday mornings at 6 a.m. They shut our gym down 2 weeks ago. And so we want people to exercise. We want you to be able to do different things at this time. But there are also many resources online about how to exercise at home, things that you can do. And we'll make sure that we also add those opportunities to our resource guide, because we do want people to still get exercise. But going outside and spending time with groups of people is not something that needs to happen right now. And Captain Dangerfield is 100% on point to make that clear.
Great. It's funny, actually, because we take our dog for a walk in the park, and that is actually one of the small things, if done in no more than in really small groups, that we can actually sort of do. And of course, I've been scouring YouTube for those videos to sort of work out right here in my living room. So there really is no excuse. There wasn't any excuse before, but this is really sort of demonstrating that, I think, for everyone involved. A couple questions actually came up, and I know that you are really sort of dealing with this. Sort of, what can we do about the homeless, right? There are a couple of questions sort of came up as, the homeless could actually help to sort of spread this if we're not sort of careful. And of course, we want to do this in a way that sort of recognizes their humanity. Can you talk a little bit more about what you're doing around that?
Definitely. Well, one, I think it's important not to stigmatize any population. Our president is doing a good job of being horrible at stigmatizing populations as it is. And right now, from a scientific and a medical perspective, there's no information that is out there to say that any population is infecting us any more here in San Francisco than any other. So I want us to really pay attention to what medical professionals are saying and what the real information is. Right now, I was just on a call earlier with some of my colleagues, Supervisor Ronan, Supervisor Haney, Supervisor Peskin, Supervisor Preston, and making sure that we come up with a plan to address concerns about our homeless population. So right now, we're working to make sure that we have a few thousand beds in vacant hotels and spaces for anyone in the homeless population that may have either shown some types of symptoms or may need to be confined for any reason, as well as working on vacant hotel spaces for our homeless population in general. People who are unhoused, getting them off the street, getting them in places where they can have shelter inside. And we are working on making sure something like that can happen as soon as possible. Hopefully, we will have some of these opportunities available for our unhoused population next week. But we are at work right now. I want to say behind the scenes, not really behind the scenes, but trying to make sure our department heads and the leadership of the city provide those spaces. And we should have some better positive news next week in terms of where our homeless population is being housed during this crisis. But just know we're doing everything we can under the law to get these vacant spaces, to get these rooms so that our unhoused population has a place to go to quarantine if there are any in general, getting our unhoused population indoors and making sure that they're safe as well.
That's great. We had a question. Is the Southeast Health Clinic on Keith involved in any type of community support? If not, why not?
Well, I think all of our health clinics are operational and doing what they can to either respond to people who may walk in the doors or trying to connect people to tests if that's something that they need. But again, in terms of a pandemic, what the widespread is, how much support we need from all medical professionals, what needs to happen across the board. We haven't 100% gotten there yet, but the Southeast Center is definitely doing what they can to respond to patient needs right now.
Yes. There are a couple actually more questions. One that is actually interesting and would love to sort of get your, not only your opinion, Supervisor, but actually everyone else here, social distancing. So for example, someone was just sharing that they were in one of the smaller markets just yesterday. It was great to see that things were stocked. But what was actually concerning is that people weren't actually adhering to the 6 feet minimum. What, if anything, can be done about that? I mean, outside of sort of people self-policing.
Well, again, we're encouraging everybody to keep 6 feet of distance. And from a common sense standpoint, you know, if you can put your arms out and touch somebody, then you need to create more space between you and other individuals. Obviously, things are a little bit harder and different in grocery stores, et cetera, but we still need to practice social distancing 100%. That means that, you know, standing back 6 feet away from people. And even if the line is long, I was in Safeway about 2-3 days ago, and lines were all the way down the aisle. And of course, it creates a different type of dynamic from a spacing standpoint, but people need to create that 6 feet worth of space and distance between each other. And yes, we are going to need people to self-police, for lack of a better term, but really make sure that they adhere to the suggestions and the mandates that have been made by our public health officials. They know and understand what this virus can do and has done right now here in the US, right here in California, right here in the Bay Area, but also across the country. And being separate and keeping our distance is a major importance. I mean, it's really more valuable to be indoors, to not be in these spaces. But if you have to, because we know there are things people need to survive, you must practice that social distancing, even in grocery stores, even in places where we know a lot of people are congregating, there are going to be lines. Social distancing is imperative if you're going to be out in public.
Yeah. Another question that sort of came through that I think is really great, you know, especially since the Bayview specifically and parts of D10 are always sort of last on the list. But really talking about what are plans to localize testing in the Bayview, potentially create pop-up testing centers or drive-through testing to do screenings like right here in our own neighborhood. Is that on the table? Can we put it on the table? And as one of like the first districts to have something like that available?
Well, the reality is, in terms of testing, we don't have enough supply here in San Francisco as a whole. And that's actually across the country. It's widespread. So we are doing everything that we can, the Department of Public Health, leadership of the city, and these are actually state and federal coordination pieces working together, because getting tests to San Francisco has been a task. And so right now, there are no specific plans for community-wide or neighborhood-wide to have specific testing in place, but we are doing everything we can to even just get enough tests in San Francisco to be able to adequately respond. Testing is imperative. It's of most importance right now to make sure that we have the ability to know who has the virus or who can contract the virus. But right now, we don't even have enough supply in San Francisco. But to answer your question, I am definitely doing everything in my power to make sure that when testing kits become available, we have enough supply here in the city, that we have equitable across San Francisco. Nobody is going to fight harder than I am to make sure that that testing is available for members of this district. But right now we have a short supply in general across San Francisco, and we're coordinating across the city to get as much testing kits as possible to serve the city as a whole.
That's okay. Thank you so much. And there's another sort of population, especially sort of being in the Bayview, where we have heightened levels of asthma, heightened levels of like other sort of health related issues, specifically because of the industry that's focused here. Is there any thought being done to sort of set aside hours specifically for those with asthma, with some kind of immune deficiency, that might be outside the senior hours, so that they can get in and get the things that are sort of necessary also?
Well, most of the conversation in terms of when you go shopping and when you go into stores right now, the allowances that have been made with early hours are for seniors and folks with disability. And of course, our folks with certain ailments obviously are part of those classifications. And so those are the recommended hours that we are hoping that individuals and families adhere to in terms of space that has been carved out for time for people to be in stores that are different than across the board. But we also will continue to reach out to our grocery stores, our folks that provide goods and services, to come up with more opportunities for several different types of populations to be in the stores differently. But I do want to reiterate the fact that there has been no scientific evidence or no mandate to say that everybody needs to go out and hoard supplies of goods and services and food. Right now, if people go to the grocery store, get enough food for a couple of weeks, like they typically do, we should be fine in terms of supply. We do have a lot of people who are rushing out to stores. We understand when we're in a pandemic, and we understand that we have a lot of people who, because this is something that is unknown. We haven't been in this predicament before, but all evidence, all research suggests that we don't all need to go out and rush to the store, and that if we go to the store like we do typically, we will have enough supply for everyone to be able to survive. And I do want to continue to reiterate that our stores are restocking just like they do typically on a daily, every couple of days, and they have reiterated that, and there's been no change in terms of them being able to get the supply into their stores. So we also don't want people to panic and change their behaviors in terms of how they shop, because we should be able to shop normally and get enough food and supply in our homes. And that's not according to Supervisor Walton. That's according to our grocery stores. That's according to the leadership across the country.
Right. Someone raised a question. Programs that address food security needs for homeless at-risk CCSF students have been suspended. Is it possible to get it reinstated?
Repeat the question in terms, what has been suspended?
Food security needs for homeless at-risk CCSF students. So just like for our young people in middle school and high school and even elementary school who had school lunches, there was sort of a lifeline for CCSF students who don't have homes. And so wanted to know if those could be reinstated, if anyone's even sort of talked about that at all.
Well, I'm glad you're bringing that to my attention. I actually didn't know that was the case. And so one, I would encourage whoever asked the question to go to Walton staff at sfgov.org, send us that email about that. We'll follow up and find out as much as we can to make sure that is addressed. But also we'll provide some other food resources and pantry information where folks can go if they are not receiving food in the manner that they have been typically. But that is a new one for me, and I will get all the information needed to address that.
And this is exactly why we have this. So thanks so much, everyone, for sort of peppering in the questions. This has happened. I've gotten a number of calls from folks. It's people sort of sharing it here. If someone's homeless, is there a referral that we can give to them? Like, where can we actually send them? Because like it's being shared. No one should be left out in the rain. Not only now, but even before this sort of pandemic. Would you happen to have any like specific areas? And if not right now, could you email that to us so I can get it out to everyone?
Well, one, I'll definitely repost and email you all the information in terms of where our homeless population can go. We have access points that currently exist. That system is still in place for our homeless population to go to the access points to work to get shelter. That will continue. There are links and resources, and I'm going to go over a list of that. We did put out a resource guide on our Facebook page. We sent out a newsletter, more than one Facebook page, all of our social media, on Twitter, and we will continue to send that information out. But our access points that are available, people can still go to the access points to work on getting shelter. Obviously, we have a long way to go to provide adequate shelter for our entire homeless population. And like I said before, we are working to get vacant hotels to house and quarantine populations that may have some symptoms or may have been infected, but also for our unhoused population as a whole in general. And there will be more detailed information about how we're housing different parts of our unhoused population next week. And that includes individuals, families, and folks with partners.
And I'm wondering, I'm just going to put this out there, and because this is in line with everything that we're talking about. Even in today's climate, there are a number of vacant luxury units that are out there, right? Is this a time to sort of take a look at all of our housing stock, including those units, and say they're going to actually be used to house the homeless or other folks like right now? I definitely sort of want to put that out there. I think it's really like important to sort of say there are vacant like units. Is that something that is potentially on the table?
Well, I think as we look at how this pandemic may grow, right, obviously, depending on the continued growth of the pandemic, how widespread this becomes, we are going to be working on the Board of Supervisors to do everything that we can to make sure that we have space available for people. Right now, not only are we looking to vacant hotels for our unhoused population, but also for our emergency care workers, our frontline workers, to make sure they have housing during this pandemic as well. And the more widespread this comes, the more we're going to do everything we can to make sure anything that's available is in place for us to address the pandemic. And so I would say everything is on the table as we have this conversation, and that goes for luxury hotels, that goes for vacant hotels in general, that goes for available homes and spaces that exist right now, and even Airbnbs for that matter. We're going to do everything we can to make sure that we address the issues that have incurred from this pandemic, and that includes getting as much housing as possible. It's just really going to depend how widespread things go to determine how aggressive we get in securing every opportunity.
Yeah. I'm going to raise the 100-ton elephant in the room. The Grand Princess docked off the Bayview. What's going on with that? These people were sort of contaminated, like at one point. Oh, sorry, not contaminated, but sick. Does it have to be here? And what measures are being taken to sort of keep us safe, since it's such close proximity?
Well, one, I want to thank our community for being vigilant. It got brought to my attention, unfortunately, via Facebook. And this is something that, again, as we talk about transparency and communication, there's no way that this should have been coming into our ports in our community without us knowing. With that said, I've definitely been in contact, of course, with the leadership of the port, with our United States House of Representatives office. And the one thing that I can say is that the ship is docked for 12 days, 10 now, and the crew is on board. There are no people, there are not passengers on board. This is the crew. They are doing a thorough cleaning. They are keeping these folks quarantined. They're not coming on and off the ship. There's no waste going into our water from this ship. That would be unlawful and against the law. But the bottom line is the U.S. Coast Guard made that decision to move the Grand Princess from the Oakland port to here in San Francisco. That is a decision that obviously we couldn't do anything about here from a local government perspective, federal, Trump state and local government, U.S. Coast Guard.